Delighted to welcome my first guest of this hour to the show. Robert Dingwall is a professor of sociology at Nottingham Trent University and is on a key committee advising the government on COVID and lockdown policy. And he joins us. Good morning to you, Robert.
Good morning, Julia.
Lovely to talk to you. All the talk right now, after we've got that 15 million target hit, and all credit to the government for doing that. Well, I think got to government, Kate Bingham, who ordered the vaccines in advance, the NHS, all those volunteers, everybody involved. But key thing about that is it saves lives. We know it's already having an effect, cutting the death rate for those who are in that age bracket that's had the vaccine. But also, crucially, it will allow the rest of us to come out of lockdown. The question right now is when and how. The government says they're going to announce their exit strategy on the 22nd. That's in a week's time. That's actually the date that Scotland is sending some children from primary school back to school. We're looking at March the 8th as the earliest for any changes in the UK, in England. Is that too long a wait, given where we are in terms of deaths, infections and hospitalisations going down? Or is that the precautionary principle at play?
Well, I think there are two issues here, Julia. One is that the precautionary principle says you shouldn't do stuff unless you're pretty sure that it's going to work. And it's been used incorrectly all the way through this crisis to justify doing stuff just in case. But the second point is that what we're seeing here is perhaps an excess of caution on the part of the government. When you've had the jab, it takes somewhere between 2 and 3 weeks, depending upon how old you are, for it to begin to have a significant effect on your immune response, on your immunity from infection. And picking March the 8th, that is 3 weeks away from the last member of Group 4 having a jab. Now, of course, most of the older people in Group 4, will have had theirs earlier on. So you're then talking about the 70-somethings who will get a result within a couple of weeks. It would be a calculated risk, but I mean, there isn't a strong justification for delaying beyond the 22nd of February. But I think we are where we are now, and we have to settle for what we've got. The crucial thing is that the government doesn't allow itself to be pushed into a position of delaying further.
Well, this is it, because all of the conversation seems to be we can't take any risk in terms of COVID infections. But the people giving the advice, and you're on a committee that helps decide some of the informal advice that goes to the government from which basis of policy is made, there seems to be absolute disregard for the not possible risks, not likely future risks, but the absolute 100% clear risks right now of the damage that lockdown is doing.
Well, indeed, and I think that's perhaps where my perspective as a sociologist is a little bit different from some of the other scientists who are appointed to the committees. Very brilliant people. I mean, they're doing a great job, but their focus is very much on controlling COVID. What I'm much more interested in is, if you like, the societal impact of the pandemic and getting a proper balance between the management of COVID risks and the management of other risks. And there's no doubt that every day that we delay getting children back to school, particularly primary age children, is doing more and more damage to their mental health, to their social and psychological development, and to their prospects for the future. And that's why I really think that it's important that we get children back as quickly as possible.
I mean, there is an argument that, say, this date, as you mentioned, this March the 8th date, which the Prime Minister had been sort of pushed into once they would finally agreed to. In fact, he originally said it was the week of February the 22nd they'd announced. And then, of course, people went, no, we'd like to have the announcement on the 22nd. So to a certain extent, whenever we get any vague date, we can at least use that something to sort of anchor the government to make a commitment on. But the March the 8th date, as you say, is after the 70 plus groups have been vaccinated and when they could be safer. But I still don't understand why that's a justification, because why should, 8.5 million children suffer at home, locked in their homes, unable to have proper lessons, being in school, unable to interact with their peers, play with their friends, and all of the importance that happens at school, because people are still waiting for their vaccine to kick in over 70, when those people should be shielding at home anyway. Everyone I know over 70, as soon as they knew that the vaccine was on, they took extra care, not seeing grandchildren, not seeing their children, deliberately making sure they were extra careful once they'd had the vaccine, to know that they would wait for the effects to kick in. I mean, it's pretty selfish for people over 70 to say we expect the rest of the country to be locked in their homes, including children unable to go to school, while we ourselves shield, when they were going to do it anyway? Shouldn't we be? I mean, should we be sacrificing our children's future in that way so that so that people over 75 can pop to the supermarket?
Well, as somebody who's on the far side of 70, Julia, I have to declare an interest here. I think that, many of us fit, active over 70s with no comorbidities are equally frustrated by the restrictions, and have been interpreting them as creatively as we're allowed to.
Oh, have you?
As is practical. But I think the central point is that it's been clear for months. Schools are a very low risk environment. Children, particularly in the primary schools and the early years of secondary schools, they're not at high risk of infection. I mean, we're talking about a handful of deaths and serious infections in the under 15s since last March. The transmission in the school environment reflects what's going on in the community. It doesn't aggravate it. It doesn't add to it. And we should have the children back in the classrooms. But what I'm worried about, Julia, if you give me a moment to say this, is what we're sending them back to, because the government still seem to be obsessed with schools as learning factories. So there's all this talk of extending school days, extending school terms, cramming through more content. We need to recognise the psychological damage that's been done to the nation's children. And when they go back, the first priority should be to repair that. And that means a lot of social interaction, play, creative activities, games, school trips, things that get children ready to learn again, rather than assuming that you can just sort of haul them back into class and sit them down and sort of bang them through geometry and algebra and the learning the kings and queens of England and all this sort of stuff. Leave that down the track. Get the children back, get them relaxed, get them ready to learn.
That is actually a very fair point, because I'm very much someone who thinks that we should be extending the school day and the like. But actually, that is a very, very, very good point, worth hearing. Just finally, can I ask you about vaccine passports? Lots of debate going on about this. There seems to be an awful lot of people who just say, frankly, you shouldn't be allowed to even not get on a plane, but even just go to the local supermarket or go to the theatre, go to the pub without having proof that you've had the vaccine. And other people fearing this is ID cards, this is control from the government and unnecessary. Where do you stand?
Well, I can't myself see the point. The whole idea of a vaccine is that it protects you. It doesn't tell you anything significant about the risk you're presenting to another person. You can be sitting next to somebody who's coughing and spluttering on a bus, and providing you've had the vaccine, the only risk to you really is of a mild infection. It's pretty much the same risk as you would take with any other respiratory virus on any other bus in any other year. Now, it may be that other countries are going to be more risk averse. It may be that we're pushed into having some kind of international certificate to travel. But the idea that you have to have a passport to go around Tesco, I think, is just ludicrous. And I very much hope that wiser councils will prevail.